And I now give the floor to Mr. Theofilos Rosenberg, President of the Hellenic Center of Disease Control and Prevention of Greece. You have the floor, sir.
Thank you, Madam Chair, distinguished colleagues and delegates. It is in this very room that we met back in June 2011, 5 years ago, for the UN General Assembly on HIV. In my home country, in Greece, we experienced over the past period a devastating outbreak of HIV in people who injected drugs. Both the well-known socioeconomic crisis and gaps as to the implementation of the harm reduction policies have contributed to this outbreak. The Greek government was nonetheless able to reverse this epidemic for this specific group of people. Working along and side by side with the local communities, the civil society and the international partners, the Greek government has rapidly scaled up highly effective harm reduction policies, HIV testing and treatment. We are now committed in maintaining these mechanisms to prevent such events from happening again in the future. The Greek government recognizes the critical present juncture in accelerating the global response to HIV/AIDS. We know now what works and what it doesn't. History will judge us harshly if we fail to act according to evidence-based practices. We should be collectively committed to be bold and practical in our approach to end AIDS. We commend the vital work by UNAIDS on setting the 90-90-90 targets, giving special emphasis in HIV prevention investments. We call upon the global community to move beyond public declaration and to scale up the interventions for key populations. Addressing to our friends in the region, in the wider region of Eastern Europe, we express our concern for the increased rate of new HIV infections, and we call upon a pragmatic public health approach in the spirit of the WHO's guidelines and the recently adopted Global Health Sector Strategy on HIV. Key populations are at the epicenter of the WHO strategy. We share, therefore, concerns raised by the civil society on the language of the declaration that is in front of us. Addressing stigma and discrimination needs to be reinforced in the everyday practice, in our conversations, and in our actual work on the field. In Greece, as in all corners of the globe, men who have sex with men are disproportionately affected by HIV. The Greek state remains committed to the concept of universal health care coverage. Early diagnosis, treatment, as well as prevention and innovations such as the pre-exposure prophylaxis will need to be scaled up in order to realize our targets by the years 2020 or even 2030. I thank you very much.